This conference will now be recorded.
Good afternoon, everyone. Just trying to make my slides. My screen just froze, but I just want to welcome everybody to the Africa Evidence Week. We are so excited for this webinar. Today, the webinar is a virtual. The Africa Evidence Week is a virtual event that aims to celebrate Africa's evidence-informed decision making. We are so excited to be showcasing CLEAR's webinar today. I'm going to hand over to Prof. Goldman to introduce the webinar and takes us forward.
Hello, everybody. This is Ian Goldman here, and we have an interesting hour or so with you to explore this case study, which is of the use of rapid evidence synthesis for a district in Uganda. And with us for this period, we've got Dr. Laurenz from the African Center for Evidence. We've got Ismael Kawooya, who's the research scientist at Makerere University, who undertook the research. We may get Isaac Ddumba, who was the client that Ismael worked with on this at some point. And we have Mina Pabari, who's the co-editor with me of a book of which this is one case study. And so just to say something about why we're here today is that many of us have been in the evidence game for some time, and and in my particular case, for example, been establishing national evaluation systems, and we've been trying to generate evidence, but increasingly the issues become, well, it's all very well generating evidence, but how do we make sure evidence is actually used to improve policies and practice? And when in leaving the Department of Planning, Monitoring and Evaluation in South Africa, I wanted to explore that further, and the Hewlett Foundation agreed to fund this project, which is a research project looking at 8 African case studies of the use of evidence from a variety of sources, and trying to learn the lessons for this so that we can use our African experience and then apply it for whether we're working in evaluation, research, using data, etc. in Africa. So we've chosen one of these case studies, and what we're going to do is Laurenz will talk through the analytical framework we've developed for the book, which is the way we're seeking to understand what has happened in the different cases, and then we're going to take one of these 8 cases on the rapid synthesis in Uganda, and we will then take some questions after that. And then Mina Pabari will present some of the emerging lessons that are coming from the book. The book is provisionally titled "Evidence-Based Policymaking in Africa: Planning and Implementation." We're hoping it will go to the publisher in November, and we should have it back. The printed books should be available from about April. So with that, we can hand over to Laurenz and get an introduction to the analytical framework.
Super. Thanks so much for that, Ian. While I'm just waiting to share my screen. Yes, so I'm Laurenz from the Africa Center for Evidence. I'm your dedicated academic for the day, so to speak, because I have the pleasure of talking about our analytical frameworks that we developed for the book. So bear with me, because it might be a little bit conceptual, theoretical, which I know is a bit of a ask on a Friday afternoon, almost close to the weekend, as it is here in South Africa. But I hope in the next 5 minutes I can give you a little bit of a teaser of why we think such a framework is needed and how it might look like. So just up front, here's a framework. You will see it at the end again. So hold on for a second. I will come back to it. There's a framework to speak to. But first, just very, very briefly, why did we think that we might need such a framework in the first place? So I think for most of us who've worked in the EIPM space in Africa, we're almost amazed by the diversity and excellence of the various programs that different governments, different universities, different NGOs have implemented. So if you look across the continent, it is absolutely amazing. And you saw some of the stuff coming out also in Africa Evidence Week. There's so much work going on in Cameroon, in South Africa, in Kenya, Malawi. And it kind of has the same goal as in that we want to use evidence to reduce poverty and inequality, but we all have used different approaches to get there really. And just to give a very quick example of our own background, we worked for a capacity building program for EIPM between 2014 and 16, and it was 4 different African teams. And we all had different ways of building capacity. Some teams focused on mentoring, other teams focused on secondments, other teams focused on training. And where we got stuck a little bit at the end, to be honest, was, well, how do we synthesize the lessons across these different teams? How can we actually compare lessons from an EIPM program in Kenya to South Africa to Malawi? And what we felt we were lacking a little bit was an actual conceptual framework, to use the same frame to analyze different types of programs across these countries. And so I think based on this experience, we thought a little bit in particular for that book where you have 8 different case studies, different countries, different contexts, different types of policy making. If we don't have a predefined framework, it might be really difficult for us to go beyond what the individual cases tell us and what we can see across the evidence base. So we needed this framework to synthesize, so to speak. So this is really just the first point, that in a bit more academic language is, what does a framework do? It investigates and unpacks the effectiveness of programs and instruments aiming to support decision makers' use of evidence. So it's a combined way of looking across a body of programs. Very quickly to flag, the framework is not intended as a deductive analytical tool, or so to say, a normative framework. So it's not time to prescribe to you how evidence-based decision-making should work in practice. It is intended to be a versatile analytical device to look across context, to look across conceptualizations, how we can evaluate evidence use interventions. So that's kind of how we see the framework, and it's based on 2 existing frameworks, the Science of Using Science and Context Matters framework, which I'm very happy to point you towards at the end of the presentation. But now onto the actual framework itself. So at the highest level, you see not yet the full framework, but you see quite a bit of it. So let's start on the far right, what we call the development impact. So what the framework is about is trying to understand different interventions aiming to support policy making to then support development impact. So it's really important for us that we do not forget the actual outcome or the actual impact of what we're all about, which is supporting development. So that's what you see on the far right, and I'll come back to it in a second. Next to it, you see the evidence use outcomes. So we believe that to achieve development impact, if our decision makers would use more evidence, that we have a higher chance of seeing these development impacts. Therefore, you see the evidence use as a second outcome. However, evidence use is a big ask. Evidence use you can break down as an individual decision maker reading one piece of evidence and defining a policy, or you could look across an entire system of decision-making processes. And this is almost the end point of what you want to achieve. And you can usually break it down in more granular intermediate evidence use outcomes. And these you see next to it. These you see in the individual organization systems change box. And we believe that you can break these down into motivation to use evidence, capability to use evidence, and opportunity to use evidence. To give an example, motivation to use evidence could be a decision maker's awareness of the need to use evidence in the first place. Capability could be the capability of an organization to have systems in place that provide incentives for evidence use. Opportunity to use evidence. This could be implementing a database where evidence is available to the decision makers at their desks. But as you can see, all of these are kind of intermediate steps. Having a database in place doesn't mean we're using evidence. It is an intermediate outcome to put in place. All of these happens in a wider contextual process. And I think, as most of us know, working in the decision-making space, there's an external dimension and an internal dimension. External factors is almost the macro context and things that are kind of out of your sphere of control as a decision maker. If there's a disaster in the country, a flood happening, this is a factor that affects the macro context that you can't do much about. On the other hand, there's many internal dimensions of context. The culture in a particular department, the organizational capacity of a team or a unit, management processes, core resources. And these together kind of frame the wider environment in which we do our work. So let's now talk a little bit about the missing element on the framework so far, the actual evidence use interventions. So we're starting with an assumed demand for evidence, that there is a decision maker or a decision-making organization who would like to use evidence. And if we have a demand, we certainly also need a supply of evidence to meet it, which we call here the evidence generation. However, how do we go from the generation or supply of evidence into actual using this evidence? We believe that often you need an actual intervention, something that is interfering in the process, a program, an action, a strategy, an instrument that does provide decision makers with this evidence. It could be capacity building, it could be awareness raising, it could be quite a few. And as I said, there is really a diversity of such interventions in South Africa, in Africa. And not just Africa, I mean, South Africa and lots of countries. I think I'm a bit confused based on Evidence Week, but there is a lot of different evidence use interventions on the continent. And where we thought, well, to make sense of them, we do need to structure them somehow. We need some organizing principles. And the organizing principle we then decided on was to look at the actual underlying change mechanisms for these evidence use interventions. And we broke these down in 6 mechanisms. One is interventions that primarily try to build awareness for EIDM. The second one is around interventions that try to build agreement between decision makers and researchers, for example, co-production. The third one is around access to evidence. This could be, for example, policy briefs, evidence databases. The fourth one, crucial, is around relationships, interactions, and trust between decision makers and the producers of evidence. The fifth one is around ability, which you could link around capacity skills, for example. And the sixth one is around institutionalizing processes for evidence in decision making, for example, the national evaluation system in South Africa. So this is really how we try to unpack the actual interventions for evidence use that we see. And now, as you have the whole framework in front of you, you can see how it links then into the intermediate outcomes and the eventual outcomes of evidence use and development impact. For example, a capacity building program using the mechanism of change for ability could use a capability, could enhance the capability to use evidence, which in essence, then hopefully if we have a higher capability, the decision maker can use evidence. And if we're really fortunate, the evidence-informed policy then has a higher development impact. So in a nutshell, this is the analytical framework. I hope it is consumable at this point. And I hope it provides a bit of an angle into how we can unpack this plethora of diverse evidence use interventions in Africa.
Thanks, Laurenz. So this is the way we're trying to understand in the different cases what has actually happened. What is the context? What has demand been? What evidence generation was done? What interventions were done to try and stimulate use? And how did those play through to get eventually use happening? And we're trying to use these case studies to see the reality of what happened and then to understand how we can generalize from that. So now we're going to take one of the specific cases. So this is an interesting case, both because of the type of evidence generation, which is the rapid evidence synthesis, and the unit at Makerere is I think a world leader actually, but certainly a leader in Africa and how we do this. But also what's particularly interesting about this case is this case didn't only work at national level, it also worked at district level, which is where a lot of implementation of services happens in Uganda. So with that, I'm going to hand over to Ismael to present on the ACES, the African Center for Rapid Evidence Synthesis, and their work in Mukono district.
Good afternoon to you all. Again, thank you very much, Ian, for the introduction. My name is Ismael, like Ian has just presented. I'll be waiting for my colleague, who is the Assistant District Health Officer from Mukono. He was held up in at the district. They had emergency meetings. But I'm still optimistic that he might be around before we finish this case presentation. However, if he's not able to, I think I'll be able to talk on his behalf about what actually happened in this particular case. So what we're looking at here is how the rapid response service was used in one of the districts. In this case, it's called Mukono district, to support decision making at this level. Basically, the objectives of the session, we're just going to talk about our experiences, and we're going to talk about our experiences, and later we're going to talk about, we're going to discuss the lessons learned about from the rapid response service. So what is it that we talk, when we talk about the rapid response service, what is it that we are talking about here? So this is a form of, we define this as a form of knowledge translation strategy that was set up to avail already synthesized, and of course, I would want to emphasize that this evidence that we use is already synthesized research evidence to facilitate decision makers in passing quick and or urgent decisions of relevance to the policymaker. And in this we are availing timely and relevant evidence where we define relevant as the best available evidence, not just in terms of quality, but also in terms of quantity, because you want to make sure that you are relevant and you support the policymaker to the best of what is available. And you also have to be timely. And timely in our situation is, we define it as doing this within less than 28 days to the time a policy decision has to be made. It's tailored, and we contextualize the evidence that we find, and also make it accessible in a package and language that is accessible to the policymaker. So when you're talking about the rapid response, just briefly, what is it that we do in the rapid response service? We have a scope, and at the time, our scope in health systems was defined looking at financing, organization arrangements, implementation strategies. And at that point where we have someone seated at the desk, that is just symbolic of a policymaker grappling with a situation where they need urgent evidence. They approach the team that is at the here at ACRES, and there is a back and forth interaction. The initial back and forth interaction is to clarify this question, to try and understand what exactly the policymaker wants us to answer, but also refine the question to an answerable format that we can use to then go ahead and search and find the relevant evidence. This process goes on back and forth, and after the process is done, we then draw up a search strategy that is compared within the team, and thereafter we look for the evidence, extract it, appraise it, and then contextualize it and summarize it. We then go through what we have as a peer review mechanism. We have an internal review mechanism where we give someone within the team who was not part of the process, preferably a senior member of the team, just to look through and see if we went through the process and we adhered to the methods that we are talking about. Thereafter, we send it out to the external reviewer, who's usually the content expert, knows a little more about the subject area, because it's very unlikely that we are experts in each and every area that we are writing about. But also this external reviewer is aware of the political environment and understands the language that we should be using. So they also give us advice on how to, on the language that we are using to summarize the evidence that we are providing. Sends it back to us, and then we summarize it and send it back to the policymaker in that format. So what we have here is we then looked at initially we had a number of target users from the Ministry of Health, civil society, bilateral partners, and other government institutions. The initial meeting had a number of people, including those at the district, who showed a lot of enthusiasm about taking this on. However, after 2 years, when we did an assessment, a feasibility assessment, we noticed that now we didn't have any question at the district. So we decided to deliberately go out at the district and try to find out what is it exactly, what are the needs of those at the district. Maybe the context is different. Maybe their needs are also different, and how they perceive the evidence that we are going to give them, or even how they use it, is different from what we initially assumed. So Mukono district is one of the districts that we set out to try this out, and we've been doing this since 2017. For Mukono district particularly, we've had 14 questions that we have worked with Mukono district, supporting them in the different decision-making processes, but also had 2 capacity building training workshops. I highlight this because you'll then see how they come out in the framework that Laurenz has just talked about. Initially, when we were starting out at the district, we called the different district leaders to a workshop just to sensitize them and let them know what the rapid response is about, what needs do they have, and how can we be of support. Then from those, we then went out and identified, initially there were 6 districts, we identified 3 that we wanted to pilot and see if this actually works out. And Mukono was one of them. So for this particular case in the book, we highlight 2 cases, 2 situations where we supported Mukono district officials in coming up with a decision that helped them in solving the situations that they were in. In the first situation, we're looking at where we had misoprostol. It was, in this situation, there was a proposal to introduce a drug that is called misoprostol to pregnant women. And this proposal was to introduce this drug to their birth preparation packages as a prevention of hemorrhage after birth by a local NGO. Of course, there was a lot of controversy around distributing misoprostol because it is known to induce abortion, and it is a restricted drug where you can't get it unless you have a prescription from a physician. But now this NGO was proposing to introduce this this drug to the pregnant women, that is before they give birth, and to top it up, they wanted to use community health workers. So you can imagine that there was a lot of resistance about that. Still, around that period, there was drive to try and reduce the burden of postpartum hemorrhage. There's death due to postpartum hemorrhage were too high, and WHO had advised that in situations where the required drugs, that is oxytocin, are unavailable, misoprostol could be used. And in this situation, it could actually fit. So because of the resistance at the district health officers then came to us to try and to seek evidence on what to do. But also they needed to show that they did due diligence before they accepted anything to go ahead. But also have some kind of surety. What does the evidence say about the risks of misoprostol at the time? So we went in a back and forth, and at the time, their first question that we had from them was, what is the effectiveness of misoprostol compared to oxytocin in combination to, or versus a combination of those 2 drugs to prevent postpartum hemorrhage? But in the back and forth interaction that we had with them in the clarification process, we then came up with a clarified question where they were actually looking at what are the optimal distribution mechanisms for community distribution of misoprostol to prevent postpartum hemorrhage. You can actually see how the question changed from effectiveness of misoprostol compared to oxytocin to now what is the feasibility of the distribution mechanisms in the community for misoprostol to prevent postpartum hemorrhage, and what are the risks around the different distribution mechanisms. And in the second case, we have they had a situation where a diagnostic test that was meant to reduce the time to diagnosing TB was instead increasing the time for diagnosis, simply because these machines that are known as the Gene Expert machines were very expensive. So they were placed at strategic points within the health system. And the different health facilities had to then send samples to these strategic points for testing. So at that point, you could have situations where someone's results come back after a month or more, just to wait for TB results. And you can imagine the loss to follow up that they had. And so the district was worried about that. This had been going on since 2015, and they had gone through a number of quality improvement processes within the district itself to try and come up with solutions, but had failed. So at the time when we introduced the rapid response service, they had an implementation partner who was interested in reducing this turnaround time, but instead wanted the district to come up with an option to do that. So the district came to us to seek evidence on how to reduce, how best they can reduce turnaround time for the Gene Expert TB. So we see, we've seen how we actually went through the different processes in trying to come up with the evidence. First of all, the clarification processes were very important in this case, because the questions that the district officials came up with initially were very different from the questions that we finally settled on to say that now we are going to look at strategies to reduce turnaround time in the diagnostic pathway for the Gene Expert, compared to the question where they came up initially. They were asking us how can they improve access to expert diagnosis. So there was a lot of going back and forth in trying to do that. But in that, we also them and show them what is coming up in the evidence and what exactly are they looking out for, to try and help them think about what they actually want to answer. So once we provided the different briefs that we showed, that at the end of the day, after summarizing, we have a rapid response brief that we provide the policymaker. Once we provided the rapid response brief, the district received them, and then they usually have what they call quarterly or monthly meetings. And in these meetings, they try to come up with the different solutions for the issues that have been coming up with. So whenever we provide them with a rapid response brief, they use these meetings to discuss these briefs within the team, which that they call the district health management team, and try and come up with try to contextualize the different options and decide on the best option. Because when we give them a brief, we give them different options that they can think about and the different scenarios for each of the options to try to contextualize what they are thinking about. So for the different change mechanisms that we see in these situations was for Mukono district, for example, in this particular case, and we might be fortunate in this, the decision-making processes at the district. Also has a master's in public health and is very interested in evidence. So he tries to push and comes to us to look for the particular evidence. But also because we had prior relationships with him, and it was a network that we formed. He was part of the network that we formed for the district health officers that we knew about. So there was that relationship that we had initially. So, but also this specific 2 cases were not the first. Actually, the misoprosto case, I think the misoprosto case came up as the 4th question, and the gene expert case came up as the 7th question. One thing the district relayed to me that when we gave them when we supported them in the first situations, and they actually saw dramatic changes when they used their evidence that we provided to them. There was that trust in what we're providing, and knowing what we're providing, and the trust in the integrity of the process, but also the trust in the evidence that we are providing. But also, they were able to, in our capacity building workshops, they were able to, we show them how to look at evidence, how to interpret the evidence, and how we actually come up with the evidence that we eventually provide them with. So in these situations, these 2 cases, what lessons have we drawn up? We have seen, we've learned a lot from 1.5 years trying to roll out these rapid response at the district, and we're currently scaling it up to include more districts because of that. Because one of the lessons we're seeing is that, of course, we knew that rapid response is demand driven, and once the policymaker comes to you, they'll more easily come up with, they'll more easily use the evidence that you give them. So it is now up to you, the knowledge broker, to try and sensitize them and try and raise that awareness to make sure that you drive that demand, that demand for the evidence, make them appreciate the need for the evidence and come to you. Initially, you may have to be driving and pushing them, because that is what we did in the first 3 cases. But then thereafter, they've been coming to us at different points. It's also important to understand the context of the policymaker. Of course, this is known that the policymaker is, the context of the policymaker is very important, and these contexts are very different. The context of a decision maker at the district is very different from that of a decision maker at the ministry. The one at the district is more interested in the implementation. They're more interested in the indicators changing, and they're more willing to use the evidence that you are providing them with to actually see what changes they're going to provide, that they're going to see, compared to one at the national level who may take a bit of time. When you give them the evidence, it takes them a bit of time to actually see the output that the impact of the evidence that you're providing them with. But also the pre-existing decision-making cultures that are available. You can piggyback on that. We were fortunate that at the district, although it's written in their procedures that they should have quarterly meetings, it is very common to find that many districts actually do not have those meetings and rarely meet at all. But in this specific district, we had a district health team that was very vigilant and making sure that they meet whenever they have solutions and trying to come up, whenever they have challenges and come up with different solutions. So when we sensitized them about the rapid response service, it was more of that our moment, that this is what they were actually waiting for. We've gone to a point that actually in situations where they feel the evidence, the solutions are not forthcoming, they'll put it on hold and first come to us until we give them the evidence. That's when they'll sit and discuss the evidence and come up with the solutions. But it is also important to maintain feasibility. It's important to maintain that demand and keep them coming. So you need to maintain the feasibility, follow up with what you provided. For the 2 cases, we had in the misoprosto case, the discussions were actually very interesting, because some of the the members of the district health team were very clear. They said they were not for this. They were against whatever they were bringing up, but they were actually very surprised when the evidence came up and showed that at a certain time, and if you do it, if you take care of certain things, then the risks and the risks of abuse of misoprostol are actually very limited. And in the studies that we summarized for them, they were actually very rare, and in some situations none happened. So they are very surprised, and because of evidence that that was provided, the situation at the district in the meetings was able to calm down. The heated conversations were able to calm down, and then think about the evidence that was being provided and come up with a solution thereafter. For the gene expert case, it was more the implementation partner, although the implementation partner had asked the district to come up with their options, they still felt like they had certain things that they wanted to do. So when they discussed in the meetings, the implementation partner wanted to, for example, increase the number of hub riders. But because now the district health officer was armed with this evidence and had prior experience about using the evidence, that increased their confidence about in discussing with the implementation partner, trying to show the implementation partner that actually we can look at something else that has not been tried yet, and that is implementing GPRS printers at different health facilities and also at the hub, so that at the time the results come up, they're printed and sent directly to the facility, so that the turnaround time, instead of a week, it was reduced dramatically to 3 days, to a day to 3 days. It was a very dramatic improvement for them thereafter. So it is also important to maintain the credibility because of the times we have worked with these with the district. They now trust in the credibility of the process, and they know what actually takes place, and we try to sensitize them about what actually happens. But also to maintain the credibility, we are going to put out this, whatever we have provided, we are going to put it out in public domain, so that we try to maintain that integrity and the credibility of the process. Importantly, still at the district, there is a lot of political, there should be political will and support. Although implementation is direct, you have local councillors, you have MPs, and they have a lot of influence on what goes on. For this particular case, in Mukono district, the district health officer told probably there are unique cases that their political leaders are very supportive and they're always looking for what works. They're always pushing them to look for opportunities to find solutions for challenges, and that pushes them to seek different ways on coming up with solutions. So in the rapid response service, when we came up with the rapid response service and showed it to them as one way to give them the evidence in a timely manner, they were more than willing to take it up. Okay, thank you very much.
Okay, so thanks very much, Ismael. That's very rich. I've certainly got some questions for you later as well. But I'd like to open up now to the attendees. I see a number of names there: Charity, Charles, Elton, Likwa, Lisa, Shona, etc. Do you have any questions? And Precious, can you give us some guidance as to how they need to ask their questions?
They can unmute themselves and and then share their question, and then once it's done, and then unmute themselves, so there's no background sound.
And they can also do a chat question, I believe.
Yes, they can do that.
So does one of you have a question you'd immediately like to ask? Okay, while you're thinking, Laurenz, you have a question, I believe.
Yes, thanks so much for that, Ismael. It's really amazing work, and I mean, as you know, Edward was here just last week to share his experiences. I was just really struck and wanted to get your reflection. So, as much as we have 6 mechanisms in the framework, I always wondered if there's some form of super mechanism that is more prevalent or more fertile, so to say, than any of the others. And in just listening to what you were saying, it sounded like you were mentioning relationships a lot. And at the same time, you also mentioned the need for proper processes and structures to have an actual service running, to not just have a once-off. So I just wanted, and so in the mechanism language, the interactions, that is really mechanism 4, and the structures and processes, that is really mechanism 6. And my personal belief, like disclaimer here, is really that those two might be kind of the secret sauce for EIDM, like the interactions and then the institutionalization. So I just wondered if you have any reflections on it, if you feel there's some mechanisms that are in your work that are more, make a higher contribution to the outcome of evidence use than others, or yeah, just to hear your thoughts really.
Can I answer right away?
Yes, go for it, Ismael.
Okay. I don't think there is one. First of all, thank you for your question. But just to answer your question, I don't think there is one super mechanism that overrides all the others. But I think it is just that how the rapid response service is structured and the process of generating the evidence, you'll find that most of the mechanisms that we are talking about, agree, trusting, the ability, are embedded within within the process, but also how you start off. First of all, you need to first make sure that this the policymakers are aware of what you're talking about. So that may take more than one meeting, and as you're doing that, you're trying to raise awareness. You're trying to increase the ability to understand, to appreciate. First of all, appreciate the need for evidence and come to you. But then also during the process, as you're clarifying the question, first of all, like for example, when they come up with the initial question may be so different from the final question, but there has to be agreement that this is what they're actually looking for. Because if you clarify that question in your head and you think they did not understand what they were talking about, then you go and look for the evidence, extract it, summarize it, and provide it to them. They'll tell you straight away, this is not what I asked. So you'll find that there has to be agreement with what you are providing. That process tries to emphasize that. But also not just agreement, they need to trust what you are providing. There is a reason why they came to you and did not proceed with what they usually do, because quite frankly, they were actually taking decisions, very important decisions, before we came to them. And they'll take more important decisions long after we leave. But we try to make sure that we still keep in their face so that we support them with making high quality decisions. When it comes to institutionalization and trying to change the organization, that takes a while. And it's more of organic. It's an organic process, because you need to first be aware that of your limitations, you as the knowledge broker, you as the researcher, that you may not, it may not be possible to go and tell them, when I give you the evidence, you may discuss, this is how you discuss, this is how you interpret it, these are the decisions that you need to make, and try to go through with them the process. It's more of an organic process. You try to embed whatever you're doing and try to piggyback on what they're doing. So within the process, within their systems, you'll find that organically you find changes happening. For example, in Mukono district right now, once they've given us a question for a challenge, they are not going to discuss that challenge until the time we provide the evidence back. It is something that happened. It is something that happened after we started working with them, and it came up organically that, you know what, once these guys give us the evidence, it actually works and helps us reduce on the time that we are going to spend in the back and forth trying to try out these different things. For example, the gene expert question, it had been going on for 2 years, and when they came up with a question, they asked for the evidence within 3 weeks, 21 days. We provided the brief, they discussed it and came up with a solution. They came up with an option. Compared with the 3 years that the 2-3 years that they were going back and forth and these different resources that they had put in. So when it comes to the issue of institutionalization, I think it's more organic. Yes, there might be some deliberate effort to try and piggyback and try and change some behaviors that might be, and that may come up in form of the capacity building workshops as you interact with them. But also we have seen, and again, you will agree with me from what SEE has published, that the relationships with the policymakers is very important. Of course, over time, these relationships are formed over time. Sometimes it's helpful if you already have pre-existing relationships. But also, even if these relationships are not available, once you've contacted them initially, try and build that relationship, and it becomes organic. They may come up to you asking for different things, discussing about different scenarios. Sometimes they come asking questions that were out of our scope. But because we would want to build the relationship, we look at the bigger goal. If you keep sending them away because of the questions that they come up with that are out of our scope, then they will not come back. I don't know if I've answered your question.
Laurenz, do you want to follow up on that at all?
I don't know if I've answered your question satisfactorily.
Okay.
No, I think you've answered it very well. Thank you.
Okay. From the audience, any questions? That you can unmute your mic and ask your question, or you can send a chat message to ask your question. Do you any of you have any questions? Okay, I'm going to hand over to Mine. Do you have any questions? Okay, so I have a question. I mean, one of the things I found very interesting, Ismael, is there's a richness coming out when I hear you talk, which is beyond what I see written in the chapter. And so I really want to get some of that richness into the chapter. And I think one of the things that I'd like to hear a bit more about is how the demand for evidence is handled. How do you handle that? What arrangement do you have with the district, with other districts, which allows them to ask for evidence?
Okay. So initially, the districts come up with their own mechanism. They decided to assign one person, that's Isaac, to approach us in case they have a question. That is for one district. So you find that most of the questions that, or all the questions that have come up from the district, often come up from meetings that they have had. And that's different from what you may see, what we see at the national level. At the national level, the urgency may be different. The urgency may come up from Parliament, may come up from the boss or the minister calling this particular policymaker, and they want evidence for a particular thing. So I think we were fortunate in a way that they assigned one person to approach the team. So at any one time, from a specific district, we have one question at a time. But also, to answer the question broadly, that how we handle the demand in case we work with more than, for example, 5 districts. First of all, we look at what capacity do we have within us, and that is how we approach it. So initially, we were working with 3 districts because we were 2 people. And if at any one time districts come up, the 3 districts are coming up with the same question, with different questions at the same time, we usually we negotiate. They will tell you we want it within 2 weeks, but then it might be because this thing has been pending on for so long, and this particular policymaker has an urgency to try and get a solution there and then. But then there is no decision that is going to be made at the time. So we try and negotiate with them, try and find out what actually, when actually that decision is going to be made, and try and adjust our time so that we're able to meet their demand. We do not go out, but then we do a phase up. Yes, come on.
Do you have like a memorandum with the 3 districts that says we will, we can provide support to you. This is the basis of the support. This is what you need to do.
It's more organic. We invite them to a training. We first of all introduce the rapid response service to them. Then we invite them to a training to sensitize them what it is about, what is it exactly we do, and what is it that the district can benefit from this. Then we have a discussion with them on how they'll find this if they'll find this helpful and how they can use this. Then we do not have a specific memorandum of understanding, but we keep checking on them initially to try and find out, do you have any question that we may help you with? That is the initial process, because they may not know, you've told them about it, but they still are not aware, they're still not certain what is it exactly that you do. But once we've done 1 or 2 or 3 processes with them, they are more aware about what we do and more willing to come back. And so the process becomes more organic after that, and they're more willing to come after that. Of course, when you look at it, what you're coming up with in trying to institutionalize this, coming up with a memorandum of understanding, I think that is for after we have not, to answer specifically, we have not thought of, we've thought about it, but we have not put it in practice, simply because the structures at the district are a little different from those at the Ministry of Health, for example. A district here in Uganda, we try to make it flexible and try to work with specific people within it. I don't know if that answers the question.
Yeah, no, that's very helpful. Just going back to the audience, any questions from the audience? No. Precious, you don't have any questions, or Promise, you don't have any questions, do you? No. Okay. All right then. Laurenz, do you have any follow-up questions? Otherwise, I'm going to ask Mine to go on to the lessons.
No, I think let's hear from Mine. Yeah, because I don't want to get too much into the framework. Might be a bit too technical, but I think Ismael has given us a really nice example.
Great. Okay. All right, Mine, do you want to come out with what the sort of lessons are that are beginning to emerge as we look across the 8 case studies?
Yes. Thank you, Ian. I'd be happy to do that. So as Ian mentioned, I'm going to speak very briefly to some of the major lessons that are emerging across the 8 case studies. So overall, I'm going to just to highlight that really across all of the case studies, one of the common stories that emerged was the fact that evidence use is complex, and it really does begin long before an evidence journey. And as such, the use of evidence in policy and practice needs to be woven into the individual as well as the institutional culture, which is quite an investment. But I think what we saw from all of the case studies, ultimately, it's a worthwhile investment. We had a wealth of lessons coming out of the case studies, and I'm going to focus on some of the lessons in these three different areas. The first area really speaks to some of the considerations before embarking on an evidence journey, and this relates to the external context that Laurenz spoke about in the analytical framework. The second area is going to speak to the journey itself and some of the nuts and bolts, really, as I like to think about it, that are important to think about in order to result in use or to strengthen the probability of use. And the third speaks to use in itself. Sorry. So in the first area, is very much related to the fact and what we saw from the case studies that evidence use does not take place in a vacuum. And Carol Weiss puts this very nicely, I think, in speaking to some of the lessons that we saw, in that evaluation is a rational enterprise that takes place in a political context. In a number of cases, we saw the impact and the influence of sort of the wider political realities that either both enabled or hindered use and evidence use. So for example, in the case of the Kenyan study, the policy review took place at a time that was well away from the election period. And this really gave the policymakers space to consider the evidence, as opposed to primarily being concerned with more political considerations. In another example, which was the case of a review of the procurement sector in Uganda, the driver behind the demand of the evidence was pressure from the development partner. Now, this was important to understand really at the onset, before embarking on the evidence journey itself, before starting to gather the evidence, because it meant, that understanding then meant that additional effort was put into ensuring ownership of the evidence, and therefore use by the government, the intended evidence users. The other lessons or insights that emerged from again, a number of the studies were linked to the realization that evidence is received by individuals, and individuals carry their own values, their cultures, their biases, fears, and they are in turn influenced by the relationships with others, and their decisions and actions are enabled and constrained by the institutional environment within which they work. So to give you an example, in the case that looked at violence against women and children in South Africa, individual norms and values against violence, around violence against women, as well as the influence of history, racial biases, these all had significant bearing on the evidence generation process. In terms of framing the central problem around which evidence was to be gathered, there was a lot of discussion at that point. The composition of the teams that were gathering the evidence, and as well as how the evidence was ultimately presented and packaged. And it was important for this to be understood and for adjustments to be made during the evidence journey in order to ensure use. And organizational structures, processes, cultures also were very important. So in cases where we saw well-established national evaluation systems, these were significant enablers of use along the way. This then really resulted in or brought us to identify a number of practical suggestions in preparing for the evidence journey. And this links to investing in understanding the context and the users right up front, which can be done in a number of practical ways, which are listed there. For example, carrying out a scoping study, a situation analysis, investing in building trusted relationships and ownerships, and Ismael spoke to this. Strengthening awareness on the importance of the issue, as well as strengthening awareness on the importance and value of the evidence. Again, I think the case that Ismael presented on rapid response really speaks to this very nicely. And overall, the case that we had from the Department of Education in South Africa, I think framed this very well, that a very important lesson emerging from this overall is being able to position the institutions and the processes to anticipate evidence, as opposed to continuously reacting to evidence demands. Having your evaluations take place on a regular basis, for example. This came out also very nicely in the case of Benin, where evaluations were being undertaken and eventually used in the case there, which was the review of the agricultural sector. The second sort of area of lessons I'd like to speak to is around the functions and roles that go into enabling and ensuring use. So I think the most commonly discussed roles tend to be focused around gathering of evidence and ensuring credibility of evidence itself. However, in the case studies that we undertook for the book, it was clear that this was only one of many core functions. So for example, the case of the Department of Basic Education in South Africa, here the role of having an internal unit that really invested in shifting approaches towards appreciation of evidence and acted as a knowledge broker, linking evidence generation and use by policymakers was critical to use ultimately. Process facilitation, this came up time and time again in a number of the case studies. Really ensuring or being able to ensure that there was well-facilitated debate and dialogue, both during the evidence generation process as well as after. And this resulted in ownership of both of the process as well as the outcome, i.e. the evidence itself, again, enabling use. Having leadership and champions or advocates for evidence was important. And we were able to identify a number of characteristics of leaders that were important to use. And here again, trust, relationships featured quite strongly. And lastly, on communication and the ways in which evidence was communicated and disseminated and shared, I think here the key point I'd like to highlight was the equal importance of the message, the content, as well as the messenger. And in a number of cases, we saw situations where the evidence was passed on to somebody, an individual that was trusted or respected in a particular field, to communicate the evidence and facilitate dialogue around that evidence, which then opened up avenues for use. And obviously, in order to undertake these functions properly, you need a set of capabilities in place. You need the structures and processes. You need teams that are fit for purpose, skills in the technical know-how. So for example, being able to analyze data, but also to be able to facilitate processes well. Relationships, trust, commitment, and resources. So having the budget, but also the time to undertake processes, having access to data, etc. And lastly, the last set of lessons speaks to evidence use and the fact that use takes place in a diversity of ways. And some of these ways are both visible as well as invisible. A number of the sort of more concrete, tangible outcomes that emerged largely from instrumental use. And this were related to changes in policy or procedures or budgets. But equally impactful were the use in sort of more conceptual or process use. And we also had a number of examples of unintended use. So for example, in the case of violence against women in South Africa, the evidence that was generated informed other work that was also picked up by other partners. Or in the case of Kenya, the community participation and what emerged through community participation in the wildlife sector was then used to develop guidelines for Parliament and used more broadly at the national level. In a number of cases, we saw where the process use also resulted in rebuilding trust that had fallen away for a variety of different reasons between government and stakeholders and so on and so forth. So this was quite important to sort of as a lesson that emerged to think about in terms of building new processes. And that brings me to the end. Thank you very much.
Thanks, Mine. So, our audience, are there any people who have any questions they'd like to ask Mine, or indeed that they've thought of anything they want to ask Ismael or Laurenz? It would seem not.
Hello?
Not going. Do I hear somebody?
Yes. Promise from the Africa Center for Evidence.
Hi, Promise.
Very well, thank you. I just have a quick question around, this directed to Mine around gathering of robust evidence. So she touched on a few issues, but I just want to find out more around advocacy. The reason why I'm asking is I'm trying to see if we're not missing any, practical ways of, being advocates for evidence use. So in the findings, what are some of the practical ways that stood out in terms of advocacy? Advocacy and advocating for evidence use.
Hi, thanks, Promise. Thanks for the question. Here, I mean, to be honest, I think some of the nicest examples of this came from Ismael's, the case study that Ismael presented around rapid response, which really puts in a lot of, and Ismael spoke to this briefly, put in a lot of investment in providing training at the district level, in ensuring that decision makers were aware of the evidence and its availability as well as its value. Ismael, do you want to add to that a little bit?
Of course, you as the researcher or knowledge broker, and again, you're the one to speak for the evidence. And in that form, you become an advocate. So you need to build the awareness. You need to put in time to build the awareness, not just at the training, but also it might be in the relationships that you form with the policymakers. But then how you also provide the evidence. You need to show them, first of all, the value for why they need the evidence. Show them how they need to, how evidence would be of value to them, and how they can take advantage of whatever you are providing them with. So it's more of a process, and yes, there is a place for it. But again, if you're thinking of where in situations where advocates now use the evidence to advocate for a particular need, I think that would be a different scenario. Still, I think it's possible. But when you're working with a policymaker and providing the policymaker with, you want the policymaker to use the evidence, then in a way, you're the one, you've become an advocate for the evidence, because you have to go out and speak for it in trainings, in private meetings, how you also provide it and make sure that the process is also trusted. I don't know if that's, that is what was expected.
Promise, do you want to follow up on that?
I can, sorry, if I may add to that just briefly.
Go for it.
I think in addition to the researcher being the advocate, I think the other thing that we saw was quite important was the role of leadership, and having influential leadership that's really behind evidence use and supportive of it played a critical role in a number of different cases.
Sure. Promise, do you want to follow up on that at all, or you feel your question was answered?
Yeah, my question was answered, but as a follow-up, it's more like a comment rather than a question itself around, leadership and advocacy, because the reality is that we may deal with difficult policymakers and face some resistance. I guess we just need to think about, creative ways of engaging them and realize the benefits of what we advocate for through our advocacy activities and taking leadership.
Yeah. But the reality is also that
if I'm to follow up on that, hello.
Go on, Ismael.
Hi, Ian.
Go on, answer.
Yeah, just to follow up on that. Hello, can you hear me?
Yes, carry on.
Just to follow up on what Promise was talking about, of course, there are situations when you are dealing with, if you're dealing with what you would call a difficult, and I'm putting difficult in quotes because the different contexts for you as the knowledge broker, but also for the policymaker on what you would call difficult, on how to deal with such situations where you seem not to be finding the common, something common between the two of you, so that the policymaker appreciates what you are giving them and also take on, but also they might be a little aggressive. So I think you just as Mina has said, there might be someone in the leadership, could be a champion, could be someone who understands what you're doing and more receptive to you. You could use that. You could use that particular person to approach the other policymaker, or but also you could do it yourself. But it will take a bit of time. You need to have the required interpersonal and intrapersonal skills and the emotional, the whole armament required to try and deal with this situation and try and get this particular policymaker to understand your side, but not just understand your side, but also take on what you're actually providing, but also take on what you're providing them with. So you may need more than, you may need to think outside the box. It might also be someone within your team. It might be that, for example, you have Professor Ruth, and you know she's very good with people. Instead of you approaching this particular policymaker, it might be you might request her to do it on your behalf. And that might open the doors and might break that, might help you jump over that hurdle or that hoop that what you would call difficult from the policymaker, particular policymaker.
So I think what Ismael is pointing to is that organizations are not homogeneous, and there are all sorts of different possible entry points within them. And so one can find ways of dealing with people who are not necessarily the number one person in the organization. And sometimes that can be more productive than dealing with people that are at higher levels. Although at some point you may need that person to respond, to agree. And Ismael was giving some ideas as to how one might be able to do that. I think at that point I'm going to call it a day for today. I think we've heard three interesting presentations. The first giving us the framework that we're working with. Secondly, this very interesting example of rapid synthesis. And what's particularly interesting, I think, is that the district perspective from it, with many of the other cases we're looking at are more national. And then finally, some of these emerging lessons that we hope to bring out in the book in early 2020. So thanks to all of the people who've spoken, thanks to Precious for organizing, and thanks to the people who've participated and at least listened to this talk over the last hour or so. Thanks very much indeed, and have a good weekend.
Thank you so much, Ian. Thank you.
Thank you.
Thank you. Thanks.
Thank you.